Hey everyone, this is SN Nerissa and today I want to demonstrate how to take vital signs. First I need to do is wash my hands and gather all supplies. Typically I need stethoscope with blood pressure cuff, some kind of thermometer, oximeter, watch, alcohol for disinfecting the items that are not disposable. Now what is collected during vital sign measurement? Well, I'll be checking blood pressure, heart rate, respirations, and temperature. In addition, I'll be asking the patient their pain rating, which sometimes refers to as the fifth vital sign, along with the collecting of their oxygen saturation. Now I'm already here at the patient's exam area and I have already performed hand hygiene. And what I need to do now is to introduce myself to the patient and explain to her what I need to do. Hi, ako di si SN Nerissa of magpapanin mo vital signs ka. Okay na ba niyo, ma'am? Okay. Then I need to check my patient's identification by looking at her armband and having her tell me her name and her date of birth. Ano sa gay tangani mo palihog, ma'am? Ano sa gani ang imong birthday, ma'am? Then I will start with the easiest one, which is the pain. And so now I'm going to ask her pain level. And this is very easy and important assessment tool because high pain ratings if the patient is in pain may alter her vital signs. It could increase her heart rate, blood pressure, and respiration. It is important, especially to ask the patient pain level if she just had surgery or some kind of trauma. So to assess pain level, with various scale, and commonly we use the 1 to 10 numerical scale. Ma'am, paano ko ninyo karon, ma'am, kung about sa imong pain level from 0, but pasabot wala kay gipamati nga sakit, 10 pasabot mo mao na siya pinakasakit sa imong gipamati nga sakit. So karon ma'am, unsa may pain level nimo from 0 to 10? She says 0, that means she has no pain at all. So since the patient said that 0, that means that she has no pain at all. But just in case the patient said 8, so I need to ask another questions like, where is the pain located at? Or could you please describe to me the pain that you are feeling? Like, is it burning or radiating or something like that? Then document the numerical scale and the exact word of the patient describing the pain and the location. And next I'm going to do checking the patient's oxygenation status. And to do that, I will use this portable probe like this one or one that is connected to the bedside monitor. And to do that, I will put this in the nail bed and make sure to pick a finger that has circulation, warm, nice, and cool. That is where we will obtain the rating. And so I will turn on the device and I will place this on the finger and let it get the reading. And now, here is the patient's oxygen saturation, which is 97%. And the normal oxygen saturation is anywhere between 95 to 100%. And beside is the patient's heart rate, but actually I will get the patient's heart rate later. And I will just take it and clean it with disinfectant wipes and document put this way and wait until it heats. And I just top this off and I will clean this, disinfect, and document my findings. And next, I'm going to take the patient's pulse, and upon getting the patient's pulse, we're going to look various things. Of course, we need to count the rate, and also we need to consider the strength of the pulse, and we're gonna grading it from 0 to 3 pulse scale, which is 0 for the pulse is absent, 1 is when the pulse is weak, 2 is when the pulse is normal, and 3 is when the pulse is bounding. And we're going to observe also the rhythm. Is the pulse regular or irregular? Now in adults, the most common site to use to take the pulse is the radial artery, because it's really easy to access and it's found. What you're gonna do is find the thumb below in this rest area along the radial bone, and this is what we call this radial artery in this area. And in taking the pulse, we can let the patient sit or lie down and support the arm and use this first 3 fingers. Don't use the thumb because it has its own pulse, and just touch lightly, don't press it hard, and count the bounding of the pulse within 1 full minute. Her heart rate is 63 and it's weak, 1. After taking the pulse, what am I going to do next is to take the respirations. Naturally, I shouldn't tell the patient that what I'm going to do next, because if I will tell the patient that I will take the respiration, it will alter her respiration rate. So I'm going to stay in this position and count her respiration rates by counting 1 inhale and exhale into 1 cycle. And the easiest way to do for me at this moment is to count is to look at the patient from this side. I'm looking at her chest bouncing. Her respiration rate is 90 cycle per minute. And the normal adult respiration rate is 12 to 20 cycles per minute. And the last thing that I'm going to do is to take the patient's blood pressure, and to do that, just make sure that the patient is sitting down and her arm is on her heart level and her legs are not crossed. And when the patient is lying down, just also make sure that her arm is in her heart level. What I'm going to do is to get my stethoscope and the blood pressure cuff, and we need to make sure also that our blood pressure cuff is the right size for our patient's arm. Because too small or too large or too big size of the cuff will alter the blood pressure. It's really important for us to know how to look at this gauge, because this is where we're going to find the systolic and diastolic of the patient. And when the patient is lying down, just also make sure that her arm is in her heart level. What we're going to do now is to put on this blood pressure cuff on the patient's arm, and we have to make sure that we find the brachial artery, because this is where we're going to monitor the blood pressure. And it's found here in the band of the arm. Here. And gauge her so it will be easier for us to read. The blood pressure is 120/90.